Hello, in this video I will show you how to replace a soft mold tube. So for that, the things that are required are obviously your hearing aid with the mold. You may require a blade, you will require a new tube, a marker and a scissor. First thing you need to do is remove the old mold attached to the hearing aid. Sometimes you may be able to just pull this off. If it doesn't come through, you will have to use a blade and then gently just cut the tube. Make sure you don't damage this ear hook. Just cut the tube and then pull this off. Once that's done, you'll have to pull the tube from the mold as well. So for that, you just have to pull it with a lot of pressure and then the tube will eventually come out. Now you don't need to use this again, so we will throw that. Next step is to use a new tube. Take a scissor and cut the tip of the tube diagonally so that it forms a pointy end. Now with this pointy end, you need to push the tube inside the mold. So push it through. This will require a bit of pressure. Now in this case, it's not going through completely. So what we do is cut it so that it becomes narrower, right? So let's do that. So I've kept the pointy end, but I've made it narrower. So let's see if it goes in easily. All right. So now it's come through. It's come on the other side. There's a bit that's protruding. So you'll have to pull it from this end. If you have nails, it becomes easier. If not, if you have a tweezer at home, you can use that. Now let's see. I'm finding it difficult with the gloves, but with bare hand it should be easy. All right. Now keep pulling the tube till this bent section reaches the opening of the mold's hole, or what we call as a sound bore, right? So what I'm doing is I'll keep pulling this, and then the L shaped or the bend has come at the opening. So that's done. Now ensure that this thing stands straight like a flagpole. So if it was bent like this, you need to just turn this around so that it's standing straight. Or another way to look at it is it should still be forming an L. Once that's done, we don't need this excess part, so we'll go ahead and trim it, right? If there's something remaining here, make sure you trim that as well, otherwise it can cause pain inside the ear. So I'm going to just trim only the tube and not the mold. So that's done. So the new tube is inside the mold. Now if you notice, the length is too long, so we need to mark this and cut it as well. So I will show you how to do that. So for that, you need to place the mold inside the patient's ear, like so. Now if you have done your job correctly, the tube would be vertical. If the tube is like this, horizontal, then you have not inserted it correctly. So make sure you turn the tube so that the tube is vertical. Then place the hearing aid on top of the ear. Now this is very important. You need to mark where the tube meets the hearing aid. Okay. Once you've marked it, remove the mold and the hearing aid, and at the marking, cut the excess tube, then attach the new mold to the hearing aid. If you have two hearing aids, do this one at a time so that you don't get confused. Now, if it's a left side hearing aid, they should face the left side ears opening. Don't attach it the wrong way. Okay? Thank you.